Progress. Recording in progress.
Hello everyone, I'll just give it another minute or two because I think we might still have a few people joining. If people, while we're waiting, if people want to, people not familiar with Zoom, if you want to put yourself on mute, I can hear people have got busy family lives and people having the dinner in the background. So if people could go on mute during the session, and we'll take answers, questions later, just so that everyone can hear what's going on. Thank you. Right, well, it's just gone 6:05, so should we get cracking? So just to reiterate, we'll just go over the kind of session again. If people who've joined can put themselves on mute so that we can hear the speakers and we don't have a lot of background noise, that'd be really appreciated. But thanks for joining us on this kind of very wet and cold and windy night. That seems to be drawing in very quickly. My name's Kay Darby, I'm the panel chair tonight, and I'm the Deputy Director for vaccination and lead the vaccination programme. So in terms of the housekeeping, if people would like to ask questions, you can raise your hand to indicate you'd like to speak. We'll probably try and take questions at appropriate points in the sort of running order after presentations. Of people who are new to Zoom, if you go to the reactions button in the bottom, you click on the reactions button, that's where you can raise your hand. Please feel free to put any questions you might have in the chat as well, and we'll try to pick those up as we go along. So the running order today is I'll let my colleagues introduce themselves. So I'm Kay Darby, the Deputy Director of the Vaccination Programme for the Leicestershire CCG, so that's Leicester City, Leicester County and County of Rutland, and I'll introduce my colleague Susan Leatherland.
Hi, yes, good evening. I'm Suzanne Netherland. I am one of the COVID leads and I work in Family, Children, Young People's and Learning Disability Division, part of Leicester Partnership NHS Trust.
And we also have Laura French joining us. You'd like to say hello, Laura?
Yeah, hi everyone. My name's Laura. I'm a doctor and I work in public health at Leicester City Council.
So the aim of the session tonight is really to allow you as parents to get some clarity in terms of the school vaccination programme and also give you the opportunity to ask questions from the panel members. So what we will do is we'll move into a short presentation by Suzanne, and then we'll open some questions out to the floor, and we'll also have a short presentation as well from Laura. So Suzanne, if you'd like to kick off with the presentation, it'd be great.
Yeah, sure. Okay. Okay, so this slide is really just describing what the COVID-19 is and why the vaccine's being offered in for young people. So it is a very infectious respiratory disease. Very few children, young people with COVID with infection do have a severe disease, but we are aware that obviously some children are getting the virus. And what we're aiming to do is by vaccinating students and young people to try and help reduce the amount of time off school and how that can impact on education. but equally try and reduce the risk of the spread of the COVID disease within schools. So therefore, the vaccination programme, as suggested in the slide, is providing protection for young people and also the wider community, but it's also helping to reduce disruption in education this coming winter. Thank you, Harry. So how we're planning the session, so it is a school-based session, school-based offer, and the vaccination of choice is called Pfizer, and that's licensed for children in this age range. We'll be running the vaccination sessions as identified in schools, which is until we start in until the end of October, early November. Now, parents, you should have received a consent form from your school. It's an online consent form, which we would encourage you to have a chat with your child, young person, about the vaccine, so that you all feel very fully informed about the vaccination. And then we would encourage you to actually complete the form as soon as possible once that informed choice has been made, and return it to the email address on the consent form. Thank you, Harry. So on the day of the session, the school will be visited by a team of very trained, very experienced, skilled vaccinators who are very professed at offering vaccinations in schools to children and young people. And at the time, they'll be able to give the opportunity for a child, young person to discuss any questions or concerns that they may have. And they're very skilled in supporting children and young people who may be feeling a little anxious, may have some worries around the vaccination or issues around needle phobia. One of the key things for this vaccination is that the young person needs to be observed for 15 minutes, and the school will be working with the school with setting up a observation area to support that. And you know, some of the key questions are being asked about other vaccinations that are usually scheduled for this time of year, i.e. HPV and the flu. These will still be offered, however, the date may change for these, but it's just to provide the assurance that these two programmes will continue, but it may be later on in the year.
That the party shouldn't. So aren't people actually quite entitled to be cross about some of the decisions you've made? The world has changed.
Okay, so one of some frequently asked questions is around, is the vaccination safe? It is a very safe vaccination, and you have the Medicines and Healthcare Products Regulatory Agency, known as the MHRA, which actually regulates and identified and confirmed that the Pfizer vaccine is very safe and effective in the age range of 12 to 17 years. It undertakes, this regulatory agency does rigorous reviews about the safety, the quality and effectiveness of the vaccine in this age group, and obviously deemed it as very, very safe. Thank you. So another key question is, what are the side effects? So like a lot of medicines and vaccines, there can sometimes be some side effects. Now, most of these are really usually quite mild and short term, and some of the key things, some of the key side effects just to be mindful of is sometimes it can have a bit of a painful, heavy feeling on the arm where the vaccination is given. It can sometimes be a little bit tender over the arm, but it's usually settles down within 1 to 2 days. Sometimes you can feel quite tired, a bit of a headache, and general aches or mild flu-like symptoms. And we just have to share that these can sometimes be the common side effects, but it's not necessarily to say that having the vaccine you would have these side effects. Some people don't. Thank you. So as we've identified, we're offering it to children aged 12 to 15, and the government have identified that these children just at this point in time will require 1 dose only. The key delivery agency is the school age immunisation service, as we said, will visit the school that your child or young person attends, and it will be offered as part of our in-school delivery. And 16 and 17-year-olds are already being offered this, and they equally are just being offered a first dose, 1 dose only. Thank you. Okay, so as we've already alluded to, we would encourage families, carers, parents, in conjunction and with their child or young person, to discuss, have a conversation about the vaccine together as a family, in view of then providing informed consent. There's an awful lot of information available about informed consent and about consent for vaccinations, and we've just identified some key ones on this slide, such as the Gov UK website, NHS website. And another very key one pertinent to Leicester Partnership NHS Trust is the Health for Teens website, which is a really useful source, and it will also help in supporting decision making. We always require consent to be able to offer a vaccination, and what we would do is, proactively encourage, as I say, families, parents, carers alongside the young person to have a discussion about the vaccine, and to work up an agreement around that. Thank you. So another key question can be around what information is available for parents and young people to access about the vaccine. I've already alluded to a website, Health for Teens, a really good resource to have a look at. Obviously, social media platforms, there's a number of national government websites that will support with providing information, e-leaflets, and some online videos. Thank you. So another key question will be if your child or young person isn't at school on the day of the vaccination it's offered, i.e. they may be poorly or absent on the day. If they don't, then we will look at what other arrangements we can make to offer that, so that the vaccine is provided to them. Thank you. Thank you.
Should we just pause at that point, because we've got quite a few questions in the chat already, so is it worth just doing a quick catch up on the questions now before we move into Laura's presentation? So do you want me to take them in order? So we've got Steve Nash has asked that if his child's already had COVID and a positive PCR test, is there any benefit in having the single vaccine dose? So do you like to respond to that, Suzanne? We've lost Suzanne's on mute. So I think the question is there any benefit from having a single dose of the vaccine if you've already had COVID? I think the answer to that is yes. It's the same advice for adults, because there's a lack of clarity in terms of how long immunity lasts after having, contracting COVID. So the current government advice is still to go ahead with vaccination, irrespective of whether people have tested positive for COVID in the past or not. The next question is my daughter's had COVID, has COVID at the moment. Does she have to wait 4 weeks before having the vaccine? Yes, she does. It's a 28-day period after the vaccine. And as you rightly say, if she misses the vaccination day in school because she's absent from school, or it's within the 28 days, we are putting a process in place to write to parents whose children have consented and missed vaccination to offer some alternatives. So some of those alternatives are still being worked up, because this is only very, very much kind of day 5 of the programme. But we will be kind of sharing more details in terms of what the options are for getting the vaccination if you're not able to get it when the school service is available. The next one we have is, can you have a COVID vaccination if your child's had HPV? Suzanne?
Yes, you can. The advice is that we always ask the question if they've had a vaccination within 7 days. But if it is after 7 days, then they will be able to have the HPV vaccination. Yeah.
Yep. Next question, a little bit more tricky. It says, my son has asthma. He's had COVID in November last year with minor symptoms. He's also born with a hole in his heart, which has since been healed and he's been discharged, which concerned about heart enlargement, and giving all of the above, what are the implications for him. So there are 2 groups of children. it would be up to your GP whether this child would be included in terms of clinically extremely vulnerable or clinically vulnerable. But any concerns around a particular health problem? Sorry, I can hear you. Hello. Sorry, I'll continue. If there are any particular concerns about particular physical conditions, it's always best to speak to your GP about that. In addition to the school age programme, we are also offering specialist vaccination sessions for people who are more clinically vulnerable, based at the hospital hubs, where there's more wraparound services, and those children are entitled to 2 doses of the vaccine rather than 1. So I think the advice would be is to discuss the situation with your GP and then ask to be referred to one of the more specialist sites rather than school if you're still concerned.
What I would just add to that, Kay, is that I know a lot of people might have specific questions about health conditions for their children, and absolutely speaking to either your GP or your specialist or your specialist nurse is the best thing to do. But the main thing to bear in mind is that there are actually very few, if any, genuine medical, what we call contraindications, so reasons why people shouldn't have a vaccine. The chief of which one really is if you're allergic to any of the ingredients in a vaccine. For almost all other medical conditions, actually the recommendation would be that you have the vaccine because you get the benefit from having protection against COVID, especially if you have an extra vulnerability, like, for example, asthma or heart trouble. And I think perhaps that question was making reference to the rates of heart inflammation that were mentioned in some of the studies. I mean, the first thing I would say is that a hole in the heart now closed is a completely different thing from that heart inflammation, so not related. And the other thing I would say is I'll talk about that a little bit in my presentation, but this side effect was actually extremely rare, so it's not something that I would be worried about in that situation. So it sounds as though your child will definitely benefit from having COVID vaccination, but yeah, please do discuss with your GP or specialist if that makes you feel better.
So the next question is safety guaranteed? I've heard that it was still in the trial process. Well, the Pfizer vaccine is not in the trial process. All the clinical trials have been completed, and it has been authorised in not just the UK, but a number of countries, USA, Canada, and Europe. So I don't know if you want to pick up the question about general safety, Laura, but the evidence is that the risk from COVID vaccinations are relatively minor.
Yeah, absolutely. I think this sort of rumour/fact came about because actually when we trial vaccinations and drugs, we have lots of phases of trials, and normally they take years to get done because there's not large amounts of funding or large amounts of people for the thing. But unusually the COVID vaccines were approved by the FDA and the MRHA before the completion of their phase 3 trials, which is the last trial phase they go through. And that was purely because they were such big trials, they had so much data that they were happy that they had enough evidence to submit to the FDA and the MRHA, who looked at them, and they were reassured that these vaccines were extremely effective, but also that the safety profiles of them were really good. There were no serious side effect concerns identified at that point. So yeah, I would be very reassured that they're extremely safe vaccines.
Yeah, so I think that covers off the other question around the safety criteria. So there is an international framework for development of vaccines in clinical trials, and the system for approving in the UK is no different to the EU or other international countries that have approved the vaccine. They tend to follow very similar lines, don't they, Laura, in terms of process? Yeah,
absolutely. They're all kind of similar. Well, certainly, as you say, EU, America with the FDA, and the UK with the MRHA. In fact, I think I'd say the MRHA are probably the most stringent of all of those.
Yeah. And then so the next, I think you've already covered this off a little bit, Laura. It looks like you will in your presentation, but it's a question about the effects on heart for young people as identified in the press.
Yeah, absolutely. Shall I just leave this question and then go through, and I'll do my presentation, and then if I've still not answered it satisfactorily, can that person still just shout up and I'll talk about it a bit more. But yes, I'm probably going to cover that.
Yeah, and then moving on, it says my daughter has allergies which require an EpiPen. Is it safe for her to have the vaccine? So the advice in relation to allergies is the only people who can't have Pfizer vaccines if you're allergic to one of the components of Pfizer. So general allergies in terms of nut food allergies, are not included in that batch. It's really if people are truly allergic to one of the ingredients, and that it would be a very rare event. But there is an allergy pathway in terms of if people are concerned they've got an allergy. Again, you can discuss that with your general practitioner, and they will make you, obviously understand more about what your child's allergic to and whether they're allergic to any of the components of the vaccine. So can my son have the flu jab as usual? This is recommended as he's asthmatic, and that's a yes, isn't it, Suzanne? Yep. So the flu programme in schools will be going ahead as planned, and that will be rolled out as usual over the early autumn months.
Yeah, we had some practice last year over the winter, didn't we, in terms of running a flu programme alongside the COVID programme. And actually last year was one of the biggest flu programmes we've ever seen, because we extended it to people, and it all went really well. So we shall see that again.
So the next question, which might be one for you, Laura, is what research has been done into the long-term effects of the vaccine, in particular?
I just read it.
They have on a person's fertility.
Yeah.
I've got a slide or two on this actually, so again I might just leave that one for now and then come back to it after my presentation, if that's okay.
Yeah. So the follow-on question around the flu vaccine was the effects of having both vaccines, and has that been trialled? As you said, last year we had a number of adults had flu and COVID. This year, even for adults, the vaccines can be given at the same time. For children, there is still recommended a gap of a week, but that gap is only so people can, not if there is any side effect, it's clear to identify.
Hello, you're right. Sorry, my work call. All right, cheers, babe. Thanks.
Yeah. We've got somebody who asks what's a vocal question. We'll cover that off at the end. How long is the vaccine effective against COVID for? If my daughter's had the vaccine and was to have COVID in the future, she should have some immunity to it, or very little. That's something you cover off, Laura?
Yeah, I mean, it's difficult to give you a definite number on that. Certainly, we're seeing the immunity from the COVID vaccines lasting, well, it's only been a year, so that's the maximum we can tell at the moment. It might well be that it's similar to flu vaccines in that they end up being seasonal vaccines, and we need to add in a new one every year to cover new strains of COVID. But I suspect that actually won't be the case, given the fact that the coronaviruses, as a general rule, don't mutate as fast and in the same way as flu viruses do. At the moment, it's a bit of an artificial situation because several billion people worldwide at any one time have COVID, which is giving the virus loads of opportunity to make new versions of itself. So I think the answer is it's very difficult to say for certain. I think it's likely you will retain some degree of immunity to the strains of COVID that have been around currently, potentially for life, certainly if you have if you've also had a COVID infection as well as a vaccine. But in terms of it staying as effective as it is in the in the first year or so after you've had the vaccine, it's difficult to say. But I imagine you will retain some immunity to COVID for a very long time, because that generally tends to be the way. But in terms of, you might need boosting, just like as I say, like we do with flu, like we do with tetanus, like we do with diphtheria if you're traveling, all vaccines, you will probably require boosters if you want to keep that very high level of immunity that you get from a vaccine.
Yeah, so we'll just cover up the next two, and then we'll move into your presentation, Laura, and then we can mop up anything that we've not answered. So one of the questions was around the booster every 6 months. There's no intention at the moment to give children boosters. As you know, this is a national programme, and who receives the vaccine and in what frequency is determined by the Joint Committee for Vaccination. So we're always guided by them. They review the current evidence and make recommendations. So at the moment, there are no plans to give boosters to children or a second general dose, but that may change based on emerging evidence around the effectiveness of the vaccine and the prevalence of the disease in the population. And the last one we'll cover off before we move on to yours, Laura, is my daughter has a poor immune system. Is the vaccine still safe? So we'd say yes, it is safe, and it's probably more important to have a vaccine if you do have a compromised immune system.
Absolutely, yeah, and obviously if you have a compromised immune system, you also then benefit from the people around you being vaccinated, because you're just that much more likely to catch anything that's going around. So yeah, absolutely, it would be a good idea.
So if we move on to your presentation, Laura, and then we'll come back to the questions in the chat, just to break it up a little bit, because
that's probably a good idea. Yeah, okay, no worries. So yeah, apologies to anyone whose question's not been answered yet, but you might find the answer in what I'm about to say, and if not, please do chime in afterwards. So as I mentioned at the beginning, my name is Laura. I'm a public health doctor. I work in Leicester City, and I also work clinically as an obstetrician and gynecologist. So I have a particular interest in asking pregnant people to get the vaccine and about various things that you'll see in a minute. Could I have the next slide, please? So what I was asked to do is put together some sort of key public health messages that I would want people to know about COVID vaccines. And the first one that I would always say is that we know that they're safe and effective. So what I've put here is that large scale trials, so these are huge trials, hundreds of thousands of people in them, mean that we know with as much certainty as we can achieve experimentally that these vaccines are safe and they're really effective at preventing serious illness and death from COVID-19. So not only that, now we're a year down the line, millions of people, in fact, I think it might even be billions of people have had the vaccine. So we've got tons of real world data as well that back up our conclusions that came out of those trials. That's not to say there haven't been serious side effects reported. Absolutely there have. You'll have probably seen them in the news, things about the blood clotting problems with the AstraZeneca vaccine or the incidences of heart inflammation with the Pfizer vaccine. But these are extremely rare. We're talking of just a few per million doses. And numbers wise, I think it's something like 7 or 8 people in the UK have died from that blood clotting problem. So it's a very rare, extremely rare side effects, and generally speaking, not something to be worried about when you're waiting to have your vaccine. Can I have the next slide, please? So what are the benefits? I mean, these are just general benefits to everyone. I'll cover off benefits to young people on the next slide. But the main thing is that having the vaccine does reduce your risk of catching COVID-19 if you come into contact with someone who's infectious. It doesn't reduce it to nothing, and that's really important to understand. And that's standard for vaccinations. It's very rare we create one that has 100% effectiveness against stopping you getting a disease. But it does reduce your risk of catching it. And then even if you do catch it, despite the fact you're vaccinated, you're much less likely to feel unwell. Lots of cases in people who are vaccinated are practically asymptomatic, as opposed to making you feel really rubbish for a week or two. The most startling effect of the vaccine is how much it reduces people's chance of needing to go into hospital by, and that's more than 90%. Why we're seeing, even though we're seeing very large numbers of cases in the community at the moment, we're not seeing the same numbers of people hospitalized anywhere near as we were back pre-vaccine, and that's almost entirely due to the results of the vaccine. Having the COVID vaccine means that you're also much less likely to pass on the COVID infection to others, like friends and family. So again, although it's not perfect, you can still infect people, particularly if you're very close to them. You're much less likely to do so if you've been vaccinated. It's also true that being vaccinated likely reduces your risk of developing long COVID, and we are seeing reports that people who are suffering from long COVID do tend to improve following the COVID vaccination. So it's likely that it will also have benefits in that regard, although of course it will take us a little longer to see those benefits. Can I have the next slide, please? Specifically for young people, so obviously healthy children and young people are much less likely than older adults to become seriously unwell with COVID-19. So sort of from that point of view, the benefit of vaccination to you is relatively small. But the other benefits that there are for children and young people are quite significant in terms of decreasing the amount of time that they have to miss school and mixing with their friends. Might be decreasing their concerns about developing long COVID, and I'm sure lots of you know that it's a similar entity to things like chronic fatigue syndrome, on post-viral fatigue syndrome, and teenagers and young people can be particularly affected by those things. And it also helps them be able to mix with their friends and their peers without worrying about getting COVID or giving COVID to other people. It's a significant benefit as well for the wider family and community in terms of decreasing the amount of spread that goes on between children at school. and then that can spill over into the families at home. So children and young people who might be worried about transmitting COVID to their vulnerable friends or family members can be reassured that by having a COVID vaccine, they're decreasing that risk. Next slide, please. What about the risks? So it's always important to talk about that because these are the things that people are concerned about. So the main thing to say is that serious side effects from the vaccines are extremely rare. Sorry, I've just seen a thing pop up saying, are you saying children won't transmit the virus of vaccination? Not that they won't transmit. So as I said before, it's not 100% effective, but the amount that people transmit is reduced by probably 30 to 40%.
But she also said, oh, you know, they needn't worry about infecting the friend.
Serious side effects from the vaccine are extremely rare. Most side effects that do get, people will know from having had other vaccines in the past. You get a bit of a sore arm, you feel a bit like you've got the flu, mild temperature, usually only lasts for 24 to 48 hours. If you have some paracetamol or ibuprofen, it helps a lot. So in the trials of the vaccine, of the Pfizer vaccine in young people aged 12 to 17, after one dose of the vaccine, the risk of serious side effects was very, very small. By serious side effects, I'm talking about the heart inflammation that was mentioned around it. So that was around 8 per million or fewer. For context, the risk of death from COVID in children is around 2 per million. So smaller than that, but as I say, the risks that you the benefits that you get from the vaccine as a young person are other than just preventing you from becoming sick. Some of the numbers that were bandied around were much larger than that, and that's for a couple of reasons. So the first preprint version of that paper had made a mathematical error that meant that the estimation of the risk was much higher than it actually was, and they retracted it and redid. And they also reported that the side effects after 2 doses of the vaccine, that risk of heart inflammation was quite a lot bigger than that, which is why they're currently recommending just 1 dose. I mean, it was still an extremely small risk, but as I say, once you just go down to 1 dose, you get significant protection from COVID, and also that risk of that heart inflammation, pericarditis or myocarditis, was around the 8 per million or fewer mark, so a really small risk, and certainly worth the risk if you take into account all the benefits. Serious long-term side effects. So people talk about how the fact that it's a vaccine, which it is, it's only been around for sort of a year or a year and a half, means that we won't know about any serious long-term side effects. I mean, that's certainly true in that we haven't got to anyone existing who had this vaccine 2, 3, 4, 5, 10 years ago. But the thing to remember is that because of the way that vaccines work, side effects that are kind of not there initially and then appear many years after a vaccine, that just doesn't happen, and it's never been reported with any vaccine because there's no plausible mechanism whereby that can work. So a vaccine works by inducing a very transient, a very short-lasting immune reaction in you, just as it does when you get a virus, so same as with measles or chickenpox, and it teaches your immune system to then recognize that virus in future and fight it off. So the actual lasting period of the vaccine is that initial immune reaction, and if that itself doesn't cause you any problems, and it very rarely does, then what we've never seen is several years down the line someone suddenly developing a complication related to a vaccine that they had years previously, and there's no plausible mechanism whereby that should happen either. So although we haven't got the experimental data to say there are no serious long-term side effects, because we can only go back for a year, although granted we now have data from several million people over a year, which is the equivalent to several million years worth of patient data, we can use what we know about vaccines, and we've been vaccinating people for hundreds of years, to say that it's very unlikely that this is going to happen. Next slide, please. So I was asked to add in this slide just because there had been quite a lot of questions about this online and in various forums as well, and about the fertility aspect. So quite early on in the COVID vaccine programme, people started spreading misinformation online that the COVID vaccine was damaging to fertility. And of course, this made people concerned, and I thought I would address it here. And the other thing that I wanted to talk about were the fact that people have been reporting menstrual changes in after having the COVID vaccine, so getting lighter or heavier than usual periods, arriving earlier or slightly later. And I didn't want to dismiss those because it certainly seems to be the case that people are reporting those. However, we do see this. So we see it with other vaccines like the HPV vaccine. You yourself, if you get periods, you'll know that if you have a period of illness or a period of stress, it can mess around with your periods, making them come a bit late, a bit early, a bit heavier, a bit lighter than normal. We're not quite sure of the exact mechanism that vaccines do this, but we think it's probably either both or a combination of the fact that your general immune reaction that's happening also means that you shed the lining of the womb a little bit differently, and also the changes in the hormones that can happen with stress, like a period of illness, they can also do it. And what we definitely know is that we see this a lot with COVID. So people who get a COVID infection will also notice this. But we do know that this effect is very short lasting, and it normally disappears after 1 to 2 cycles. And we know that it's a temporary change and it has no effect on a person's fertility, which their ability to get pregnant, which we know because we've now got data where people have gone on to have successful pregnancy who've had the vaccine. So not only have we got no evidence that there is any harm to fertility from this vaccine, we also have plenty of evidence that no vaccine has ever adversely affected fertility, and there's no plausible mechanism whereby it could do so, in the sense that we know that we see these short changes, but it doesn't stop people getting pregnant. And just at the end, just something I always mention, just in case anyone has friends, family who's concerned about this, the COVID vaccine is also recommended for those currently pregnant or breastfeeding. Again, we've now got data that shows it's safe in pregnancy and breastfeeding, and also significant benefit in terms of antibodies passing to baby and protecting the pregnant people at the end of their pregnancy from severe COVID. So that's just to sort of address some of the things that you may have seen online, be worried about, just to reassure you that, yes, these menstrual changes can happen, and they don't happen to everyone, but they can happen. We do see them, we see this with other vaccines. It's not an issue. We just, unfortunately, historically, the scientific establishment has not been very good about particularly caring about periods. So you don't often see this information published in vaccine trial reports. But anecdotally, we know it's there, we see it, but we also know these things about it. So it's not something to be concerned about. It's just, it is inconvenient. I think that's probably my final slide for now. Can I just check? Listen, there's not another slide on there, or Harry, or whoever's driving the slides. Yeah, so that's my final slide. I hope that helped some people with some of the questions they have in the chat, but we'll obviously pick up anything that hasn't. From now, I'll hand back to Kay.
Yeah, we've got a few questions around antibody testing.
Oh yeah.
Someone's asked around, is there any plans to antibody test? There aren't, and there aren't any existing plans to antibody test adults either. And so the plan was, is there any plans, and why don't we antibody test instead of vaccinating?
I think in terms of antibody testing, it's quite obviously this is a new vaccine with a new virus. We're still learning about it. Although there's not been widespread antibody testing, there are always quite a few trials going on with antibody testing in adults. And the reason that they're doing that is because at the moment we don't know what the significance of antibodies are in terms of response to COVID infection. So what we're seeing is that not everybody makes antibodies, and some people will make antibodies but at much lower level than others, and we don't know what that equates to in terms of immunity. So in terms of antibody testing at the moment, there's no specific pattern of antibodies that we know of where we'll be able to confidently say, yes, you're immune to COVID, you don't need a vaccine. The antibodies that you get from infection are slightly different to the antibodies that you get from a vaccine, and they sort of work together, and so we would always recommend that you have both, because then you're much more assured of that level of immunity.
Yeah. And I think closely linked to that is someone's asked whether, and we get asked this quite commonly, about after a vaccine, would a child test positive in a PCR in the following weeks following vaccine?
Yeah, no, you won't. So good question. Absolutely, but no. So a PCR, what that looks for is little fragments of viral genetic material, so DNA floating around, which you get after you've had. So a vaccine, which just causes you to produce that spike protein and an immune reaction to it, that doesn't trigger PCR positives. And I also asked this question about lateral flow tests when they very first came out as well, because I remember wondering the same thing, and the answer there is also no. So a vaccine won't give you a lateral flow test positive either.
Yeah. Now we've got another specific question around an asthmatic child with multiple learning disabilities, ASD and ADHD, and effects of the vaccine on that child. And I think the evidence, isn't it, Laura, that it's very safe for all children to receive. And in fact, I think some people with severe learning difficulties, the benefit of being vaccinated is often those children can't communicate the symptoms, so there's more risks in terms of illness because often communication is limited, and they can't be able to. I speak from being a parent of somebody who has ADHD and ASD, and they can't always articulate very accurately how ill they feel or what their symptoms are.
Yeah, absolutely. And social distancing can be much more difficult for them. Mask wearing is more difficult. So yeah, absolutely. I think what I would say is, if your child has specific needs in terms of getting a vaccine, certainly talk to your school, depending on where they are, talk to your school nurse or about whether they need a little bit of extra time. And also perhaps it might be more difficult for them to, as Kay said, articulate if they're feeling a bit unwell afterwards. So they might, a bit of a headache. So perhaps be ready with the Calpol a little bit earlier than you would do normally. But yeah, absolutely. In fact, we would recommend, because of the increased risk of COVID. Yeah, absolutely.
And then another specific question around a child who's had Kawasaki disease when they were younger, and a concern around the heart inflammation again.
Yeah, that's one I would defer to a paediatrician, because I haven't done paediatrics for a very long time, and Kawasaki disease is, as you say, a systemic inflammatory disease, and one of the things can be heart inflammation. My understanding of the trial data is that your risk doesn't increase with a preceding incidence of pericarditis, myocarditis, which was the same as what we saw with the AZ vaccine, and actually having had a blood clot previously didn't make you more likely to have this because it's such a rare thing. But I would definitely just run that past either your paediatrician or your GP, but I strongly suspect the answer will be yes, absolutely fine.
Yeah, I think we've already covered this off in your presentation, Laura, about was a clinical trial on children, or has it been based on the trials on adults?
Yeah, no, it was done on children aged 12 to 17, I believe. I can't remember the exact numbers. It was largely done in America, and it was done with Pfizer, which is why we're using Pfizer vaccine in this country. Pediatricians get insanely angry when we just say that children are little adults and try and use the data. So we don't generally do that.
And then I think this is an interesting one. It gets covered off quite a lot, doesn't it? On I think particularly in the media around JCVI report saying the benefit was too small to support universal vaccination, but however we've gone ahead with vaccination 12 to 15-year-olds, and why aren't we following JCVI guidance? Yeah, it's an interesting one, that, and I think we in the public health community were quite surprised by that JCVI decision, because although we accept that the individual benefit in terms of protection from severe COVID is very small for children, as I said, the mortality rate is like 2 per million for children. It's very rare. What we felt was that the wider benefits made it much more worth it, and I have to say the Royal College for Paediatrics and Child Health agree, and that they fully back the decision of the CMOs that in terms of trying to stop the horrendous disruption that children have seen to their lives in terms of from COVID and all the worry that they might be feeling about catching COVID or passing on COVID, that it is worth it, even though necessarily that protection from severe COVID isn't as important to younger people as it is to older people. Yeah, I think we've just got somebody who's concerned around the lack of testing and testing trials on animals, which have proved that the vaccine is not effective and that COVID's not being isolated. Oh yeah, I think that was a rumour that went around again quite early on, that there were no animal trials for any of the COVID vaccines, which isn't true. There were complete animal trials for all of them. The difference is that they were run simultaneously with the phase 1 human trials, which is kind of unusual. As you imagine, the wheels of science normally turn quite slowly for funding and various other reasons, but they were fully animal trials, and basically it was just done at the same time as the early human trials, because they were already quite happy with the technology. They've been trialing it for a while, so they just got everything done to begin with. But yeah,
So that is an incorrect bit of misinformation that was put about early on, but it's not correct.
Yeah. I'll give you a little bit of a break. I've got a couple for Suzanne. We've just got a couple of process issues around consenting in school and how people access the consent forms. So could Suzanne just outline what the process is if people, what process will be for when the school vaccination process gets round to the school?
So communication's gone out to the schools and they're sharing that communication with parents, and inclusive within that is the online consent form link. If the parents can go onto that link and complete the online consent form and then return it, then we'll be able to see the consent form and see the decision that the parents made. So for the lady who's the person who's put on the chat around wishing their daughter to have it, if they could follow that process to do it online, if they haven't received it by the school, if they just give the school a call and just ask them to to send it, because all the communications has gone directly out to the schools to forward on to all the parents within their school.
Thanks for that. And then one in relation to clotting, Laura, in terms of have there been any common underlying cause detected in terms of the clotting issues from the vaccines?
Hang on, let me just bring it. So that syndrome has not been identified at all with Pfizer or Moderna vaccines. So far as I know, it was only with the AstraZeneca vaccine, which is a slightly different mechanism. The underlying causes was thought to be a very rare syndrome that these people developed of a combination of low platelets and clotting, which are two kind of opposite blood-related things that we very rarely see in combination. And it was probably due to just an extremely rare and unusual immune reaction in them to that jab. So, but in terms of one predisposing factor that they all had, no, we never. There was nothing. So it was just this extremely rare syndrome that appeared in these few people.
Yeah, thank you. And I think this is a question or a statement we see quite often around 70% of hospitalisations of people who've been double vaccinated. So where in fact do the facts come from around the vaccine being effective?
Yeah, I mean, absolutely. It's true that there are certainly people in hospital with who've had both jabs. It's not always 70%. In fact, sometimes it's lower than that, but the proportions do change. But crucially, the percentage of people who are in ITU who are very sick, it's much less than that. So we would expect to see people in hospital now who've had both jabs, purely because depending on which estimates you use, 80–90% of the adult population have had the jab. So, if 100% of the population had had the jab, 100% of the people in hospital would have the vaccination. And it doesn't mean that it's not working. So what we're seeing is that in terms of proportions, if it didn't do anything, we would expect 80–90% of the people in ITU and dying to have had double jabs and only 10% or so not. But that's not what we're seeing at all. So of the people who get very severely unwell and end up in ITU, those that die, the vast majority are either unvaccinated or have only had one vaccine. So in terms of protecting you from very severe illness and death, we're absolutely seeing that 2 jabs is the way forward.
Yeah. I think we may have covered this off, but it might be worth going over again in terms of will children eventually build up their own immunity to COVID without a vaccine?
Probably not. It's probably coronaviruses behave a little bit like the cold virus. They're also coronaviruses. So as you know, unfortunately, none of us ever get fully immune to colds. So probably you wouldn't. You would definitely develop a degree of immunity, but how good that was and how long it lasted for is difficult to say.
Yeah. And then a couple of ones I think that we've just for clarity around the 28-day period. So is that from the test or from the end of quarantine? It's from the test, isn't it, Suzanne?
Yeah.
So that's from the test. And the other issue around 11-year-olds, so the rising 12-year-olds, and what will be the plan for those 11-year-olds to be vaccinated?
Sorry, is that for me?
Yeah, I was just saying the 11-year-olds, obviously everybody 11 is going to be 12 shortly. So what will be the plans going forward to pick up those 11-year-olds that will be coming up to 12 in the near
Yeah,
future.
so we're looking at the processes and the plans to try and how we can offer those who aren't 12 on the day of the visit. It makes it tricky because obviously, you know, children will reach the age of 12 at different points in the year as such. We'll just be working through some plans for that.
Lovely. So we've got a few comments in terms of limited numbers today, and will the webinar be shared? So I'll just look at kind of comms colleagues in terms of confirming that it is recorded and it will be made available. But if someone could kind of, I suppose, answer in terms of where the recording is going to be made available, that'd be really useful. And another one probably for yourself, Laura, in terms of from being vaccinated on day one, what's the lead-in time in terms of
yeah, good, excellent question. So you do actually, with the Pfizer and Moderna vaccines, which we're not using this program, you do start to see some protection really from kind of day one, day two, but we don't consider it to be fully working until for at least 14 days afterwards, and it probably keeps building for around 20, you know, around the 28 days after, but yeah, we say 14 days.
Yeah. So yeah, the question linked to that, sorry if I've just been surgery, is around why is there a 28-day window following having COVID to being vaccinated?
Yeah, so that is kind of England and the UK are being more precautionary on this, I think, than other places. So the theory there is that if you generally speaking can feel a bit rubbish when you have COVID, and if you then go on to have a COVID vaccine, which makes you feel a bit rubbish on top, you might risk getting, you know, having a relapse in your COVID symptoms or getting poorly or whatever. And so in terms of making sure that you've kind of recovered from your COVID, and then you can start again with a COVID vaccine to do that immune response, that's the theory, but it's not super vital. So the FDA in America, I don't think they're doing this actually. It's more precautionary to make sure that you don't get a kind of combination of being unwell with COVID and then being unwell with a vaccine and not knowing what's going on.
Yeah.
If you don't have, I know someone said what are the implications if you've had COVID but you don't know and then have the vaccine. Again, that's okay. I mean, if you've had COVID and you didn't know, you didn't have symptoms, then it's, you know, you're unlikely to be unwell and therefore it's probably not an issue. So don't worry about it in that sense. And as I say, the WHO I think aren't necessarily doing it because they vaccinate in some parts of the world where the most important thing is getting a jab into someone's arm when you get the opportunity, whereas because we have such a great organized vaccination program in this country, we have the luxury of having that window of safety to allow people to make sure they're recovered from their COVID before they get a jab. Yeah. So don't worry if you've had COVID and you don't know, it's all right.
And there's a question around given the 28-day gap, does that mean that you should wait 28 days to have a follow-up lateral flow test?
You mean wait 28 days, have a lateral flow test, then wait and then get your vaccine?
Yeah, I'm assuming the question is if we don't vaccinate for 28 days following a positive COVID result, do we then not do a lateral flow test for 28 days?
Oh, right, I see what you mean.
Yeah, sorry, I'm probably not wording that very well.
No. I mean, the recommendation after having had COVID would be to go back, after you come back from your isolation, to go back to normal testing regimes. So complete your 10-day isolation and then just go back to your normal. There's no reason why after that period of time you should be positive on a lateral flow at that time. So I wouldn't worry, basically, is what comes out of that. But no, there's no need to pause your testing in the run up to a vaccine. That's fine.
And then just a couple of minutes left. Just got some questions, people in terms of minimum age is 12. So there will be that process put in place to pick those people that we call the rising 12s, 11 and 3/4. It's not clear in terms of the ongoing rollout of the programme yet, because we have to wait to be guided by the Chief Medical Officer and JCVI. And it is a single dose of the vaccine unless 12 to 15-year-old has any clinical vulnerability or is clinically extremely vulnerable, and then 2 doses is recommended for that. And then in terms of where the webinar is going to be posted, that's going to be posted on the Health for Teens website afterwards, along with all the FAQs, frequently asked questions. So I think that probably wraps it up, and we're probably just bang on time. So I think it was a really informative session, and thanks very much for your time, Suzanne and Laura, and thanks very much to audience for your engagement and your questions.
Yeah, thank you. Yeah, it's always great when you get people ask, because you can tell that there's at least several people in the audience are probably thinking the same thing. So it's really great when people are willing to pipe up with a question. Yeah. Sorry, I haven't probably been able to get around them all.
No, I think we've got the last one around the symptoms of any art information, but in terms of part of the consenting processes is people are told what to look out for following vaccination. So that's you get quite. Having had my 16-year-old vaccinated, it's quite a detailed process to outline what minor and more serious side effects to look out for and what action to take.
Yeah, there's some good stuff on the web. If people want to know more about pericarditis, myocarditis, the British Heart Foundation has a good page on it that's nice and accessible. But as I say, I think the best thing to do will be to look at those that information that comes with the consent form.
Yeah, thank you. So I think that kind of concludes tonight, and thanks very much for everybody for joining tonight, and hope we could hear with the rain passing on the roof in the background. So have a good evening, and we we'll hopefully give you enough sort of food for thought in terms of making an informed decision about whether your child's vaccinated or not. So, thank you.
Thank you very much, everyone.
Thank you.
Thank you.
Thanks.
Thanks.